Hi, Dr. Milky back with another educational foot message for you. I've been seeing a lot of problems around toenails, big toenails in particular. And I've always seen a lot of ingrown toenails over my career. And a lot of the problems have to do with that, but other things as well. So I'm going to just bring my thumb here. You know, back here in the cuticle area, I've seen a lot of redness and a lot of pain in that area. And that can come from bacteria getting under the cuticle. Sometimes gals going to get a pedicure, that can be a problem. There's just different reasons why that can happen. It could be like minor trauma, it could be a shoe that might be pressing on there. It could be hiking and activity that causes irritation to that skin, you know, right behind the cuticle there, redness and soreness. And sometimes, unfortunately, the nail gets loose and sometimes the nail has to be removed and then a new nail will grow back, fortunately. So when a nail comes off, the root is still there, so the nail will grow back. But then again, also ingrown toenails on the side and redness that forms, you know, on the side. It can be on this side or this side of the nail. You know, those get pretty painful. And so much of that is genetic. They just want to grow into the flesh. So certainly cutting the nail straight across and making sure that you're not going into the corners, making sure if you go see a pedicurist that they don't go digging around the corners and trying to pull things out, because that can cause an ingrown toenail and bacteria can get in there and that can be a problem. So, you know, the nail is a structure where a lot of things can happen. And unfortunately, because our feet are not in a great environment, you know, there's bacteria around there. So an infection can happen even if you wash your feet 3 times a day. So just kind of watch for those things. Just a couple tips, you know, redness, make sure you address that quickly. Usually got to be put on an antibiotic for that. Some Neosporin, Polysporin, triple antibiotic ointment, and a Band-Aid around there is important, covering that. And just, you know, making sure that you address any kind of sign of infection or anything like that, especially if you have diabetes or any other condition that might compromise your immune system. We'll see you next time.